Happy Tuesday, everybody. Dr. Zom here with yet another episode of Tooth Teacher Tuesday. Today, we're picking up where we left off a couple weeks ago in our mini series on the ins and outs of dental insurance. Um, just kind of as a reminder, the goal of kind of discussing this topic versus other clinical topics is that, you know, insurance is a very complicated and, you know, controversial, shall we say, subject. And on top of that, times are tight. Our economy is going through a recession. Inflation rates are through the roof. Cost of everything is going up, and so I think it'd be beneficial to just run through how things work so that you can better understand from your own side of things how insurance benefits you, harms you, and then also see how dental insurance both benefits and harms your dentist. Um, because knowledge is power, and so the better you understand it, the better you can kind of appreciate the overall grand scheme of how things operate. So, picking up where we left off, we kind of finished last time talking about PPO plans, which is going to be the most common type of dental insurance. As a reminder, a PPO plan essentially you can see any dentist you want, and depending on whether or not your dentist has signed a contract with that insurance, you may be in network or out of network with your dentist. Only difference there is that out of network is going to, you'll still have the same benefits, but in network is just going to, well, we'll get into more of a breakdown here. I've kind of written up a very official, formal looking breakdown of how dental insurance works. So essentially, we're going to use just round solid numbers here to make it simple. So if you were a patient who came into a hypothetical practice, and that hypothetical practice charged $1,000 for their crowns, they tell you need a crown, and we charge $1,000 for a crown. If you don't have any insurance, then your fee ultimately would be $1,000. Now, if you have a PPO plan, then there's a couple different ways this can be broken down. If you have a PPO plan, but you go to a dentist who is out of network with that insurance, then essentially what will happen, and again, these are just simple round numbers just to make things easy. Doesn't mean these numbers are truly reflective of anything, but just as a general idea, if you went to an out-of-network dentist with your PPO plan, that $1,000 crown, that crown would be filed with your insurance. Your insurance company would come back and say, okay, well, since that dentist is not insurance, you're not in network with our insurance, your dental insurance plan is going to pay $300 towards that crown, which means you as the patient will be responsible for the remaining $700. Okay, so a little bit more affordable, a little bit more manageable. Still a big investment, but at least your insurance gave you some benefit. Now, if we switch over and look at a dentist who is in network with your PPO plan, similar scenario, that $1,000 crown, your insurance again is going to say, okay, well, your benefits for a crown are going to be $300. But in addition to that, because your dentist is in network with us, we're going to force them to take an in-network write-off of $400. That in-network write-off is essentially, I would kind of jokingly, but not jokingly, compare it to, like you see in the movies, the insurance mobsters that pay, come and smash up your place and say you have to pay protection money. That's essentially what an in-network insurance write-off is you're the insurance tells the dentist, if you want to be in network with us, then, you have to alter your fees. And so they tell the dentist, no, you're not allowed to charge $1,000 for that crown. You're only allowed to charge $600. You have to take this $400 write-off. And then of that $600, your insurance will pick up $300, the same benefits you would have out of network, but combining that in-network write-off with your benefits, that would leave only $300 for you as the patient. Looks a lot better when you put it that way, but what your insurance company is going to try to convince you is that your full benefits wasn't $300, it was $700. They're going to make it sound like they saved you $700, which they did, but 400 of that is what I would call dishonest, because essentially what an in-network write-off is the contract between the dentist and the insurance company, which says, okay, you, the dentist, are going to take that hit to your bottom line and write off $400. In exchange for that, we as the insurance company will promote you as one of our preferred providers. That's where the PPO comes from, Preferred Provider Organization. And so we're going to advertise that you are in network with us. And in exchange, you will take that hit, which ranges by procedure, but in general, the in-network write-off is going to be right around 40 to 50%. And those numbers keep going up as the insurance companies, hate to say it, get more greedy. So again, it looks like it looks like you have really good benefits, but in reality, your benefits are the same whether you're in network or out of network. It's just a matter of how much your dentist is penalized for being in network. And I would compare it to a penalty, because that write-off is supposed to be in exchange for being advertised as being in network. But I don't know about you guys, but I don't know too many insurance companies that make it easy to find out who's in network and who's not. I mean, usually if you want to find that out, you have to call the insurance company and then wait on hold for an hour, and then maybe you'll get a direct answer, maybe it'll be wishy-washy. So what you end up doing, and wouldn't fault anybody for it, it's much easier to just go on Google, find the highest rated dentist that you can find, and call them up and ask, do you accept my insurance? And, I know that doesn't seem like a big deal, but essentially, that's the work that the insurance company should be doing, explaining who's in network and not, is then put upon the dental offices. So not only are we taking this in-network hit, but we're not even really benefiting from it, because we're doing the work for the insurance company anyway, which probably leads most of you to ask the question, well, why would a dentist be in network with an insurance then if that's the case? And that's a whole nother rabbit hole we can go down in the future. This video is already pretty long as it is, but pretty complicated and touchy subject, so won't go too much further into it right now. But again, that's kind of the breakdown of how a PPO plan works, and I hope that gives you a better understanding of why your benefits may seem higher with one dentist versus another, why dentists might choose to be out of network because of those fees associated with taking an in-network write-off. I know for us personally here at South Circle Dental Care, we are contracted with a couple of PPO plans, not a whole lot, but regardless of your insurance status, we're always happy to file your insurance for you, fight for every last cent of your benefits, whether you're in network or out of network. Yeah, that's kind of the breakdown of it. Hope this has been educational for you and enlightening into a little bit of the inside track of dental insurance. We'll pick this up in 2 weeks, talk about some other topics in dental insurance. Next week will be another clinical topic. But until then, signing off. Hope everyone has a great week, and thank you for tuning in to Tooth Teacher Tuesday.